This is the true story of Amina, a patient who was told her swelling was a spiritual attack when in fact it was a medical emergency. Amina's journey highlights a critical and sometimes tragic choice many people of faith face when dealing with serious medical symptoms. Amina first noticed significant swelling in her body, a symptom that should have immediately warranted a trip to the doctor. Instead of a hospital, Amina sought help from 3 different prayer houses, where she was repeatedly told her ailment was a spiritual swelling from an enemy. This spiritual advice led to a dangerous delay in receiving necessary medical treatment, turning a treatable condition into a life-threatening crisis. The remedies offered included rubbing anointed olive oil, drinking special water, and finally, a 7-day fast to break the so-called spiritual attack. Fasting, especially without proper medical guidance and when already ill, can lead to severe dehydration and dramatically worsen underlying conditions, which is exactly what happened to Amina. On the 5th day of her fast, the spiritual crisis turned into a full-blown medical emergency. Amina collapsed. Her body, already struggling, gave out under the severe stress and dehydration from the prolonged fast. When she arrived in our unit, her lab work was terrifying. Her potassium was dangerously elevated, and her creatinine was through the roof. The diagnosis was acute kidney injury, or AKI. Her kidneys had shut down, likely triggered by severe dehydration combined with an infection she had been ignoring. The key takeaway in conditions like AKI is recognizing that every moment matters. Acute kidney injury is a time tissue condition. Every hour of delay means more kidney cells dying, making recovery longer and less certain. Many patients feel they must choose between spiritual intervention and medical science, but this is a false choice. I am a woman of faith myself. I believe in prayer, but the spiritual and the medical are not enemies. You can absolutely pray for healing and also take the medication prescribed by your doctor. Both can coexist. You can fast wisely for spiritual growth and still trust the kidneys God gave you enough to protect them by seeking medical help when needed. Amina recovered after 9 days, but her words stayed with me, and they are a vital message for everyone. When Amina left, she held my hand and said, "I wish someone had told me earlier. So I am telling you now, swelling, reduced urine, fatigue, and confusion are not spiritual problems. They are concrete medical emergencies. Please, if you experience these symptoms, go to the hospital first. Your life may depend on it."